Okay, so this is practical number 3. We're going to start right away with the skull. You can see this is regular anatomy, so we are starting with once again, the frontal bone. So as we look at this guy right here, here's the frontal bone, obviously. We've already done some of this with the full skeleton. Here are the 2 parietal bones. You can see I've turned them around. There's a right and a left. Let's talk about the sphenoid bone. We can see this a couple different places, but the best place to see this is if you take the top of the skull off and you look down here in this area of the skull, this whole area in here, it looks like a butterfly when you take it apart. This is your sphenoid bone, okay? That's where I want you to look for it. Foramen magnum, foramen is a hole. Your temporal bone is on the sides. If we put this thing back on, the cap back on, your temporal bone is here, and obviously there's one on the other side over here. This is temporal. External acoustic meatus. Basically what that means is it's your ear hole. Right here is your ear hole. Okay? External acoustic meatus is right here. The occipital bone is the back of your skull. Okay, so it's back here, and it's also a lot of the floor of your skull as my thumb sweeps over that. So that's your occipital bone. The occipital condyles, if I turn the skull upside down and kind of look at it this way, this is the mandible. The occipital condyles are right here. This is where your spine sits on top of, or your skull sits on top of that first cervical vertebra. So these 2 things right here, these nice smooth condyles are smooth articular surfaces. Those are the occipital ones. The mastoid process is actually close to the ear hole or the acoustic meatus. This right here is your mastoid. That's your mastoid process. The styloid process, if you know what a stylus is, that's a pen. So this kind of looks like the tip of a pen. There's one on each side of the skull. The external occipital protuberance, that's that bump on the back of your head I told you about way back in the first week of school. It's on the back, on the occipital bone. The ethmoid bone is in the eyes. So when we look at the ethmoid bone, it's going to be deeper into the eye sockets here, and here on this side, and the ethmoid bone is right in here on this side. Superior orbital fissure. That would be this guy up here. A fissure is kind of a slit, so that's going to be this guy on this eye, and this guy and this eye. Okay. The palatine bone, that's your hard palate in your mouth. The palatine bone is right here, okay, right there. The mandible is your jaw, okay, that's this lower jaw. The mental foramen, a foramen again is a hole, so the mental foramen, there's one on this side, and there's one on that side in the mandible. This allows for nerves and blood vessels to pass through and provide nutrients. The maxilla is the upper jawline up here. The nasal bone, that's this bone up here. This makes up your nose. When you break your nose, this is the bone that gets broken. The rest of this is all cartilage out here. This is your nasal bone. The zygomatic bone is this whole bone right in here. This makes up your cheek. There's one, of course, on both sides. And we have the zygomatic process, which is this is usually what you break when you break your cheek. This is very, very thin, and it can break easily. So again, they're on both sides. The lacrimal bone, lacrimal fluid is tear fluid. So there are holes right here to allow ducts from your lacrimal glands to allow you to cry. So right in here inside the eye, where these little holes are, those would be your lacrimal bones. There's little ridges inside of the nose. There's a superior and an inferior. These are the inferior nasal conchae right in here and on this side over here. Okay. The vomer bone is that bone that goes right down the middle, right here. Okay. When we look at these, the top of the skull, we have different sutures, and they kind of close as we age. So we'll talk about that in a little bit. We have the coronal suture, which is the front suture between here and here. We have the sagittal suture, which is this one right here. we have the squamous or squamous suture right here, and you can see these border all of those bones we just talked about on the skull. And then we have the lambdoidal suture. It's hard for me to do this with one hand. There we go. The one that separates the occipital bone from the two parietal bones. When we talk about fontanelles, if you look at the bottom of your sheet, there's fontanelles. These would only be on a fetal skull, however, we don't have them. So where these are those soft spots that you hear people talk about in a baby's skull. And if you have a little brother or sister, you might have, if you were alive when they were a baby, you could feel kind of where they indented, where you could kind of put your hand at certain spots and there was like a little dent. Those are called fontanelles. So we have them at the junction of our sutures here. So right here, when we're looking at this, right here would be the frontal fontanelle. There's only one. Right here, back here, would be a whole a fontanelle where these are going to come together as we age. So this would be the occipital fontanelle. On the sides here in the front, this would be the sphenoid fontanelle. This would be the left one. Here would be the right one. And then, of course, we have, excuse me, the mastoid. Remember, we talked about the mastoid process. So there it is. And right here, where that suture comes down here, this would be another soft spot. That would be the mastoid fontanelle on that side. And we have it on this side as well. And that concludes practical number 3, skull.